is Alina Femlamba. In this edition of NBC Exclusive, I'm joined by Mr. Peter Phiri, the Country Director of Water Aid Malawi. Welcome to the program, sir.
Thank you. Thank you for having me.
So, Water Aid is a key player if we're to look at the wash sector. From where you stand, do you think you're doing enough if we're to look at issues to do with water, hygiene, and sanitation?
Yes, as Water Aid, we're a wash-focused organization, and of course, our mandate is to provide safe water, but also good hygiene, as well as improved sanitation to the communities that we're serving in the country. So working hand in hand with the government towards that goal. So in terms of how we are performing in terms of our mandates, certainly we have been in Malawi since 1999, and we have worked in various communities in over 12 districts and still counting. We have intervened in about 60 healthcare facilities, providing a complete wash package, that's water, sanitation, and hygiene package in those healthcare facilities. So in terms of the work that we're doing quite a lot, but we know the challenges are still there.
What are these challenges?
Yes, maybe to begin with, in terms of access levels, if you look at the WHO UNICEF Joint Monitoring Program, in terms of access levels as a country, we are slightly doing well in terms of access to water supply. But when it comes to sanitation and hygiene, we are quite below. And that also puts a risk in terms of us meeting the SDG 6 targets.
So then should we say this is one of the causes of the rise in waterborne diseases, especially in urban areas?
Yes, it's partly contributing towards that. That's one of the key issues, especially when it comes to issues of cholera, diarrheal diseases. We know at the center of it, it's an issue of communities using unsafe water sources or contaminated water supplies and not practicing good hygiene behaviors. So at the core of it, it's being reflected in terms of the disease burdens that we are having. And these are preventable diseases.
Why is it that most urban areas are still have poor supply of water?
Yeah, for urban areas, possibly if you're comparing it with the rural side, the urban areas are better served generally across the country. But still, currently as a nation, again, quoting from the JMP figures, I think we are, in terms of safely managed water supply, we're at 18%. And basic access, that means people can still travel to a water source for a return trip of 30 minutes. 54% of the population are in that category. So even in urban areas. So again, we would want to, the desired goal is where everyone has access to safe water as and when it's needed and within their own compound. So that's still far-fetched kind of dream at the moment, looking at the numbers where we are currently.
What about those in rural setups?
In the rural setups, as I said, it's even worse because I think it's only currently around 49% that are able to access basic water services currently. That means close to 51% of the population within the rural side don't have access or have poor access to safe water supply. And others are using even surface water. So that's the kind of disparity that we see between the urban and the rural.
As Water Aid, if you're to look at this disparity, doesn't this worry you?
It does worry us. We are serving communities in both urban and rural setting. Of course, for the urban areas, they're slightly privileged because you also have water utilities that are able to provide piped water supply. But within the rural side, that's still not that prevalent. There are systems that are working, but still, as I indicated, the majority are not able to access safe water supply. So it is worrying. Efforts are being made. We applaud the government in terms of the efforts that are being made to bridge that gap. But still, looking at the time that we have to materialization of the SDG targets, there is still a lot that needs to happen. And even in terms of the investments that as a country we are making, we need possibly to quadruple that kind of investment levels. Yeah.
Malawi experienced the worst cholera outbreak a few months ago.
Yeah.
How did you respond to this as WaterAid?
Yes, as WaterAid, we did join the rest of the partners, first on two fronts. The first one, it was in terms of meeting the immediate needs of those that have been affected, so providing safe water supply, but also providing wash supplies in terms of chlorination, tablets, but also doing hygiene behavior change promotion. Those were some of the activities that we were able to do. We also distributed quite a number of wash supplies in those affected areas. Secondly, we have been also part and parcel of the work that the government is doing in terms of developing a cholera response plan, a costed one. We are part of the conversation, we are part of the task team. We hope this will help to resolve the issue for the longer term. So those are some of the efforts that as WaterAid we have been making. So we have responded directly, but we're also part and parcel of the coordination mechanism in terms of drawing up a clear plan to address the cholera issue for the longer term.
Much as cholera is no longer a threat in the meantime,
Yeah.
what lesson have you learned?
That's a good question. In terms of lessons, I think there is that need to continue investing in water supply, sanitation, and hygiene if we are to get out of this challenge for the longer term. Because at the core of this is the use of unsafe water sources, poor hygiene practices, lack of proper sanitation. So we still need to invest rather than dealing with it as an emergency. If we can make clear plans from the onset in terms of addressing the wash challenges, I think we'll be able to address this issue of cholera for the longer term.
In the meantime, do we have adequate infrastructure to deal with this?
Currently, in terms of the infrastructure gap, it's quite huge because for you to practice good hygiene, it also needs to be supported by the relevant facilities. We're talking of toilets, we're talking of hand washing stations, we're talking of safe water sources. So in terms of infrastructure, we are not there yet. While the efforts are being made, even by us and other partners and the government, but still the gap is still big. So that's an area that we still need to invest as a country if we are to get out of these challenges.
Apart from the infrastructure aspect,
Yeah.
what other strategies do we need to implement as a country so that we get out of this on a longer term basis?
Yes, beyond the infrastructure, there is also the need to look at the system as a whole, the enabling environment. Here I'm talking about aspects to do with financing, aspects to do with the planning, aspects to do with coordination. These are key sector building blocks. If we do not address the enabling environment, obviously there will still be facing challenges. So there are all these aspects that will help us to get out of this problem. Looking at the sector as a whole, strengthening the sector, the wash sector, these are elements that will help us to really sustain the gains that we are making, and also making our systems to be resilient, being able to bounce back after a certain shock, like what we have experienced recently with climate-induced hazards that have actually eroded some of the gains that we have made. So we need a system that can bounce back. And for that to happen, you need to look at the collaboration within the sector, all the players working around a clear plan, but also looking at the issues of using data to inform the decisions that we make in terms of planning, but also making the necessary investments from the financing side. So there are all these elements that will really strengthen the system and also make us resilient to some of the challenges that we're facing.
WaterAid is just one of many other key players in the wash sector in Malawi. What have you done to make sure that the environment is enabling, as you've put it?
Yeah, from our end, I think as WaterAid, we've been quite instrumental working with the government and other partners in terms of strengthening collaboration. We also know that looking at the complexity of the challenge that we have, water aid alone cannot solve it. So we need to look at strategic partnerships. We need to work together with like-minded partners. We need to work across sectors to address this issue, because it doesn't just affect the water and sanitation side, and water and sanitation is also a social determinant of health. So we also need to work with the health sector as well. So as water aid, we have been part and parcel of all the coordination efforts that are happening in the country and within the sector. We have also been a key player in terms of supporting government in terms of policy formulation, for instance, development of strategies within the sector, but also just looking at water aid in terms of our programming. We always integrate WASH with the other related sectors, be it health, be it nutrition, because we understand the key role that WASH plays in all this.
Malawi is well known for putting things on paper, but when it comes to implementing, it seems to be a challenge for us. What sets you apart from the rest?
That's a good one, Alinafe. We have talked about that as a country we're very good in terms of formulating policies, strategies. What sets us apart? Basically, for us, we generate the evidence in terms of the work that we're doing and really showcasing to say this is what is working. We are modeling to influence others to follow suit. The work that we are doing, be it in healthcare facilities, our core aspect of purpose is to say this is how WASH should be addressed within a healthcare setting. And then let others also follow suit. So we use our service delivery to generate the evidence of what works. So really translating the policy into practice so that we can showcase to say this is what is really working. Maybe just touching on that, one of the key programs that we have in our current strategy is also looking at attaining universal access, contributing to attaining universal access in a focused geographical area. So we are focusing on Kasungu. That's just one of the programs that we are doing.
Just Kasungu.
Just Kasungu.
All right.
Demonstrate what achieving universal access would look like. And again, this is a vision that we have together with the Ministry of Water and Sanitation, but also our partners. But we want to draw the lessons there and then apply them somewhere to say this is what can happen if we do it well.
In case you're just tuning in, this is MBC Exclusive with me, Alinafe Mlamba. My guest today is the Country Director of Water Aid Malawi, Mr. Peter Phiri. We'll be back after this short break. Welcome back. This is MBC Exclusive with me, Alinafe Mlamba. We're continuing this edition with the Country Director of Water Aid Malawi, Mr. Peter Phiri. Why is it that Salima district was severely hit by cholera, yet it's one of your catchment areas?
Yeah, that's a good question. Yes, it does play. It is our catchment area. We are relatively new in Salima.
When did you start operating in Salima?
In Salima about 2 years ago under the project that I just mentioned. This is the USAID funded project which we're implementing in Salima as one of the districts. But we know in terms of access levels, there are still areas that are not well served with access to safe water supply, improved sanitation and hygiene. Also drawing from the numbers that I was citing from the joint monitoring program, again it tells us that yes, there are efforts that we are doing, but we need to cover the biggest part of the district so that we eliminate the challenges that we are facing.
Okay, so should we say that these challenges that you're facing can also be attributed to some of the funding woes that some of the players in the WASH sector faced a few years ago?
Yeah, I think as a sector we have been affected by funding challenges. You will recall at some point some major donors withdrew funding towards water supply, sanitation and hygiene for various reasons. That has contributed to that. But also, if you look at the investments from the public sector, apart from the rest of us as WASH players, in real value, even though we have seen increased amounts in kwacha terms, but in terms of real value, putting all the macroeconomic factors into play, that investment has been eroding over time. So I think that calls for a need to invest more in terms of water supply, sanitation and hygiene interventions.
So as WaterAid, how have you been surviving?
Yes, as WaterAid, I think we have really been supported by quite a number of partners and also some foundations. I can cite a few examples. Over the period, we have been receiving funding from the Wimbledon Foundation, Amani Aqua Foundation, and we're able to do some work in Chisi district to the point that in terms of interventions in healthcare facilities, we're almost reaching 100% of the district in terms of healthcare facilities that we have supported in Chisi district. And it's thanks to foundations and charities. But we have also been recipients of USAID funding. We have two big programs that we are currently implementing over a period of, the first one is, the first project is focusing on Zomba and Mangochi. It's winding up towards the end of this year with USAID funding, and we have been able to do quite a lot in terms of water supply, sanitation and hygiene, integrating it with nutrition. The other one is the Momentum Tigwezo Moyo project, which we're implementing in Chitipa, Katsungu and Salima, which I alluded to earlier, and it's also thanks to USAID funding. But also the thinking that if we are to address issues that are affecting the sector, we need to look beyond just the wash sector. Because most of these projects that I'm highlighting, they're health projects where wash is integrated. So we are seeing the benefits when it comes to integration. Yeah, so we have, I can say, been privileged that over this period, we have received funding to support our work of service delivery, but also the work that we are doing, be it with regards to policy and advocacy work. So we've been really funded over this period.
Now that you have the funding, what are your main priority areas?
That's a good question, Alinafe. In terms of our priority areas, I did indicate that we have a new strategy which is building on the development blueprint of the country, the Malawi 2063. And in there you see that WASH is sitting under the enabler of human capital development. And there are clear targets that have been set out, ambitions that are coming in the first 10-year implementation plan, the MIP1, in terms of improving access to water supply, 100% within the 10-year period, and sanitation up to 74%, and hygiene up to 75%. So our strategy is building on that. We have taken on those ambitions, and we have two key aims that are driving our strategy. The first one is the one that I indicated, where we're looking at contributing to universal access in a focused geographical area. The second one is looking at WASH becoming a norm in health service delivery. So this one is building on the work that we have been doing in healthcare facilities, but also ensuring that water supply, sanitation and hygiene is well integrated in health programs. And not just programs, but the plans and the budgets. Because you have seen, even from the experience that we had with COVID, that at the center of it was preventive health. Hygiene was quite critical in terms of addressing some of these challenges. We have talked about cholera. We have talked about diarrhea diseases that are also contributing a lot in terms of infant mortality. So we would want to see water supply, sanitation and hygiene being at the core of the health service delivery in Malawi. That's one of the key priorities that we...
Are you serving Malawians well, especially if we to look at issues of sanitation and hygiene?
Yeah, I do recognize that we still have challenges there. And some of the challenges are a bit systemic because they are building on some of the shortfalls that we're having.
As WaterAid, are you serving Malawians well?
As WaterAid, we are doing our very best to serve Malawians. As I indicated, just in the last 5 years, we have been able to improve access to safe water supply for over 1.2 million people. And 1.3 million people now have access to improved sanitation thanks to the work that we are doing. And over 2.8 million people have access to good hygiene because of our hygiene programming work that we're doing, be it at community level, at institutional level, healthcare facility level. So yes, we are doing quite a lot. And that's just a sample from the last 5 years. But if you look at the period that we have been in existence, there is a lot that we have contributed to the country. But also bringing the much needed resources within the wash sector. It's an area that I think as Water Aid we have done quite a lot, getting funding from key donors so that we can improve the lives of Malawians in the areas that we are working.
Mr. Phiri, we are almost 6 years away before the Sustainable Development Goals mature.
Yep.
And if you to look at SDG 6, it talks about clean water and sanitation for all.
Yeah.
How have we done as a country to achieve these targets?
Yes, I think a lot has happened. Looking at the government efforts, the work that we're all doing as players within the sector, but also the development community. But again, from the numbers that we are seeing, we have done significantly well when it comes to water supply. And still, there are those glaring gaps in terms of sanitation and hygiene, where we are quite below, as I indicated earlier. That puts into question that as a country, within the remaining 6 years, can we reach or can we achieve those targets? Yes and no. Yes, because it's possible if we have the right environment, the right plans in place. No, because looking at the current levels of funding to the sector, there have been quite a number of studies. Others have been talking of $174 million that we need annually if we are to meet those targets. Others have, the figure is slightly higher in other cases based on the estimates that are being made. And as I said, on average, looking at the level of funding that's coming to the sector, we needed possibly to multiply that 5 times if we are to accelerate progress towards meeting the SDG targets. So financing is one of the key challenges. Beyond issues of coordination, collaboration, clear planning, but I think financing is a key bottleneck at the moment. So yeah, it does put into question whether as a country we're going to meet the SDG targets within the remaining period.
All right, Mr. Phiri, it was nice having you in this edition.
Thank you, Alinafe. Thank you for having me.
Thank you. And that's what I had for you in this edition of MBC Exclusive. My guest today was Mr. Peter Phiri, the Country Director for Water Aid, Malawi. My name is Alinafe Mlamba. Until next time, goodbye.